about how do you prepare for potential health issues later on. Preparing financially means that the dollars are going to need to be there in some way above and beyond what Medicare will cover. Our first one is from Samuel in Little Rock, and he writes, I'm 57 and have had some health scares lately. It's got me thinking, what kind of options do I have for health care in retirement? And is there anything I should do now to prepare for potential health issues later on? Samuel, thanks very much. You're 57, so the Medicare part of this is where we're going to start. And obviously that's several years off, so there's not a lot you need to do to prepare now. But we're going to kind of talk about how your health care coverage, your health care expenses will be covered to some degree in retirement, John. And everybody's going to have access to Medicare. So that's the first place we want to start when we talk about our health care options.
Absolutely. And it's very important if you're approaching age 65 that you go ahead and sign up for Medicare. You do have to sign up for Medicare. Now, Medicare Part A is your major medical expense plan. Call it hospitalization insurance, if you will. That's free. That is provided by the government through taxpayer-funded methods and is absolutely free to you. That is Part A Medicare. Part B Medicare, you pay for, and that is more of your doctor visits, your specialist visits, the tests and things of that nature that have to be run, and that's where you get to pay for some of that expense. And so when you think about Medicare Part B, this is where there's a lot of people that really don't understand, how this whole system works. Medicare Part B has a base premium of $174.70 a month, but it is a graduated premium based on how much your income is. So it's means tested, if you will, meaning people that make more money or have more income coming in post age 65, they're going to pay more for that health care coverage. It can go all the way up, Scott, to $594 per person if you're in the upper income of someone who is 65 and beyond. And really and truly, that is based on your overall income, not just your salary, but your overall income. So if you have investments paying you money, or you have capital gains that you get from a sale of a property or something like that, that's impactful on what they call IRMA. And that is I'm not even going to attempt the acronym, but it is IRRMA, I believe, or IRMMA, I can't remember which. But basically, it is a means-tested, graduated premium for Part B Medicare.
Yeah, so this brings forth the point of how important, another reason it's very important to have a retirement income plan that shows you what you're going to be taking on a monthly basis so that you'll know your annual income and how that will affect your Medicare premium, and then working with an advisor to work through the tax implications of that. Maybe you can get more money into a Roth IRA, or maybe you can take income from different sources that can keep that overall income down to keep you from having to pay more on the Medicare Part B premium, because the range is quite substantial, $174.70 a month all the way up to $594 a month, depending on your overall income. Now, the other part of that is we don't know, Samuel doesn't say when he's planning to retire. So a key issue for folks, we say this all the time, the average retirement age in this country is 60. Well, it may not be across the board, but most people think about retirement at age 65, and that's the main reason, because they are trying to get to Medicare age. That doesn't mean you can't retire before 65, but you have to have a plan for health insurance past that. Many times you can get some short coverage on the back end of work through COBRA.
Yeah, COBRA is out there. It's about an 18-month payout as far as COBRA is concerned. And when I say payout, I mean you pay the premiums for about 18 months, and you have coverage extending for 18 months past your last working day at your employer. But after that, you have to then go into the marketplace and find coverage for yourself, and it can be quite expensive. But there are some subsidies, some tax subsidies and things of that nature for people of limited income. There is also an important point I want to go back to on Medicare. don't forget to file for Medicare at age 65, because there is a permanent penalty if you do not file within the time frame, which is about 3 months before your birthday and 3 months after your birthday. So you don't want to get imposed a permanent penalty on your Medicare, because, again, that permanent means it stays with you the rest of your life. And so that is something that you've got to be sure to be aware of. Also be aware that, Scott, Medicare just doesn't cover everything. It's not a carte blanche, okay, if I just pay this, then I'm good.
Yeah, back to Samuel's part of his question about how do you prepare for potential health issues later on. Preparing financially means that the dollars are going to need to be there in some way above and beyond what Medicare will cover. We know, based on some data from a 2018 survey, the average amount of money paid by retirees in that calendar year equaled 25% of the average Social Security benefit. So if you think about that, first of all, it highlights the need to have assets and income above and beyond Social Security, but a quarter of your Social Security check could be going to out-of-pocket healthcare expenses, and the average retired couple can expect to spend $315,000 throughout their lifetime on healthcare expenses. So what to do now is to begin to have money allocated for that. One of the best ways to do it, Samuel, and for other people listening, is if you have an HSA available, a health savings account. It comes through your employer. You would have an opportunity to do that if you had a high deductible plan. That allows you to divert pre-tax dollars into an investment account, in essence. And I say investment account, if you can invest it, you should be investing it if it's for retirement. A lot of people leave it in cash, and I understand that if they're going to use it in a very near-term basis, they should be doing that. But investing it for the long term, allowing it to grow, and then when you withdraw those contributions for qualified healthcare expenses, it is a tax-free withdrawal. So it's double tax-free. You get it in without the dollar being taxed. You get it out without the dollar being taxed. So that's a great way to build in pre-retirement some dollars for healthcare expenses. But the other part of that, John, is you can also set aside some money. If you've invested money in other places, not in an HSA, if you know what you're going to be living on and it's a comfortable retirement, you can begin to plan buckets of money for health care.
Yes, absolutely. And you might also want to pick up some type of Medicare supplement policy. Mm-hmm. There is a standard Medicare supplement that just dovetails with Medicare. But then there is the Medicare Advantage plans. Now, the Medicare Advantage plans, I will just be real frank with you, I'm not a big fan of them, and we here at GenWealth don't regularly recommend them. But for folks that are really constrained as far as their income is concerned, it might be an alternative. But understand that that's much more like a HMO type coverage than it is a preferred provider organization, which is what most people are used to in their health care coverage. One other thing before we leave this topic, Scott, let's talk about long-term care. Long-term care is something that is not acute care. It is not your day-to-day health care expenses, but this is for if you cannot take care of yourself by yourself or at home or whatever the case may be. This is for a significant percentage of people who, frankly, have their head in the sand and don't think it's not going to happen to me. Yeah. But the statistics bear out that if you're 65 and healthy, there's about a 50% chance that you or your spouse is going to need some type of long-term care coverage. So we really need to do a lot better job of uptaking the subject and the actual coverage for long-term care.
Not everybody needs long-term care insurance, but everybody needs a long-term care plan. You need a plan on how to determine how you're going to pay for the long-term care that you might and more than likely will need in retirement. Samuel, thanks for the question. There's so much more we could talk about on the health care, the long-term care, the insurance front, the retirement income planning front. All of this is part of the GenWealth Ready to Retire process. So if you're like Samuel, you're 57 or around that age, and you're thinking about how to prepare for health care in retirement, it's part of the holistic planning that we do here at GenWealth. And if you'd like to start that planning process, you can reach out and call toll-free, 866-653-PLAN. That's 866-653-7526. You can schedule an in-person appointment with a GenWealth advisor. You can schedule a phone call with an advisor. Just ask your healthcare questions. We'd be glad to advise on that and talk to you a little bit about your options.